Hi, my name is Iradukunda Safari. I'm going to talk about the project called Approach to a Healthcare. I have different information I need to present in front of you. The first one is about the general overview of healthcare option. When considering a healthcare option, so many students can mention a few options like doctors, dentists, nurse, or a veterinary. However, different careers path existing in healthcare field. So there is an organization called HSRS, which is in charge of helping students identifying possible careers option. So possible careers option. So you can learn a healthcare option in three different ways. The first one, you need to learn some of healthcare career option which is available to you. The second one is talking about online courses which can prepare you immediately for the opportunities. The third one is that you need to search for credible resource which can help you to get more information which is trusted. So there are some examples of career path available in healthcare. So the first one is medical assistants, social workers, pharmacy technician, physical therapy assistants, and social workers. So a part of those, there is three examples of non-clinical healthcare jobs. The first one is patient advocate. The second is quality improvement coordinators. The third one is informatic nurses. There are many, but I select only three which I need. It can be an example I can present in front of you. The first one, which is called patient advocate. It helps patients at healthcare facilities by answering questions concern the patient has about the treatment. So for this, it is where he or she need to, if you are a patient advocate, you need to make a schedule of patient appointment. So the second one, which is called quality improvement coordinators. A manager, you need to manage and coordinate a healthcare team and to handle much of the administrative tasks that came with running a healthcare facilities. So the goal of this person who work on quality improvement coordinator, they need to develop and implement process to improve and maintain patient care qualities and standards. So about the third one, which is informatic nurse. This person, they are responsible for evaluating healthcare facilities needs for clinical IT application and implementing the technology. This person also are responsible for training and educate the staff on how to use new system and technology that come into the facilities. There is a description of the education and skills necessary to work in non-clinical job. I'm going to start about the skills. So if you are going to work in non-clinical jobs, so you need to have the skills of time management, delegating with other workers, pressing multiple stakeholders, meeting requirements, and checking off a list like a boss. Also need to take responsibilities and being reliable. So also need to rolling with the punches. So after understanding the skills, also there is education. Education is that public health educators, human resource, health informatic managers, healthcare administrators, insurance process and sellers, medical recordings. After that, there is a meaning of allied health professional. It is term used to describe the broad range of health professionals who are not doctors, maybe dentists or nurses, They work to prevent, diagnose, and treat a range of conditions and illness, and also they work with a multidisciplinary health team to provide the best patient outcomes. So there is a description of 6 examples for allied health professionals. The first example is that a dental assistant. Those they provide patient care and taking X-rays to record, keeping, and scheduling appointments. The second example is medical laboratory technologies. So they collect sample and perform tests to analyze body fluid, tissues, and the other substance. Another one is medical assistants. Those they help complete administrative and clinical tasks in the office of physician, hospital, and other healthcare facilities. Another one is dental nutrition, dentists, and nutritionists. So they are experts in the use of food, and they need to give advice to the people how they can use different nutrition as the way of managing different diseases. Another one is about physician therapy. So they help injured or suffering people improve their movement and manage their pain. Another one is a speech language pathologist. Those help to prevent communication and swallowing disorder in patients. So another one is about a different organization like LNFP. The first one is the licensed practical nurse. Those are nurses who care for people who are sick, injured, conference, disabled. They work under the direction of registered nurse or physician. So there is a education requirement for recent practical nursing. The first is there is basic nursing, medical terminology, infection control, lifespan healthcare, and pharmacology. So after that, there is a job responsibility for licensed practical nurses. So those are keeping a check on the eating habits of the patient and how many times they are using the washroom. Also, they need to admitting and breathing patients, interviewing patients, and examining their medical history. They need to regulate vaccination and injection. They need to keep the health record update. Those was the job responsibilities for licensed practical nurse. So another one is about which means the registered a registered nurse. So the graduate trained nurse who has been licensed by a state authority after qualified for registration. So there are education requirements. There's bachelor degree, associated degree. So about and diploma, also diploma can be an educated requirement about RN, which means registration, registered nurse. So about the job, the responsibilities, they are promote and restore pain health by completing the nurse process, collaborate with physician, providing physician and psychological support to patients, friends, and families, supervising assigned team members. So the last one is a nurse practitioner level of nursing. So those are resented autonomous clinical focus on managing people's health condition and preventing disease. So the educated department about this is master's degree in education. Their job responsibility as primary care nurse practitioner, pediatric nurse practitioner, geriatric nurse practitioner, and physician nurse practitioner. So this is the end of my presentation. Thank you for understanding me, and I can see you.